pay. We recently applied for Medicaid, and we got tentative approval. So that will open up services to those who can't afford it. So, you know, we're looking forward to going into that.
And any plans for expanding services through the Regency at Hualalai on the island?
On the island, over in Hilo, Regency Pacific is our corporate office is building, or they haven't started yet, but they're in the process of breaking ground, an assisted living and an independent living facility. It'll also have a skilled SNF and ICF building, so it'll be a continuum of care, which will be a nice plus because we certainly need the beds.
Mm-hmm. And with the long-term care veterans home in Hilo, I mean, those were additional beds that were provided, but obviously the demand is much greater. Do any of you know the services that are being provided by, I think it's the Office of Aging, through the county at that what used to be the old Sun Sun Lao restaurant facility? Are
yeah,
you aware
it's
of that?
the closest you can. It's the closest you can come to, you know, one-stop shop as far as outpatient services for the elderly, who are frail and you know, really vulnerable. You know, as a primary care doctor, you have to be everything to everybody. So I'm not very successful as a social worker. I'm sorry. So I don't know if I'll be able to tell you exactly what they got. I know that my patients that go there, you know, are usually very happy with the referrals they get, and you know, kind of chore services maybe, or you know, maybe a helping hand, you know, somebody to come in that's paid a little bit to go out and get groceries and so forth. Yeah, but I don't know if I can comment, and I should know this, but I don't know exactly the.
But in terms of you know, being an information resource, they can fulfill a lot are those needs.
Right, they do very well. Well, we use them as such. Maybe
are you talking about the
inappropriately
ADRC?
sometimes.
Yeah. Are you familiar with that facility, Stuart?
You have one on the Big Island, but is it off the ground? I thought that they had some.
Yeah.
It is off the ground.
Pam is nodding. Yeah.
Yeah, it is off the ground.
Okay, they have one in the city and county, a virtual one. I think it's city and county Honolulu. Right.
But it's more information sharing, you know, so people can go in.
It's a gateway.
Right.
It's a triage kind of a operation. But getting back to Craig's point, once you get through the triage, you know, then you run into the traffic.
Right.
And the traffic is the congestion. It's, you know, it's a traffic jam. And I think the last session we talked about. AARP had 11 providers of home care, nonprofits, not for profit, but nonprofits, and of the 11, 8 basically said that they had to wait list clients. So, you know, there's a lot of congestion there.
Is that the community-based kind of services?
The community-based. I mean, you've got the nursing homes who aren't. You know, they're full up. You've got the care homes and foster homes that have got pressure of their own, and then you've got these home-based services, and some of them are waitlisted.
You almost need, you know, I was talking about social services, but you almost need a case manager or somebody to maneuver the elderly, you know, through these outpatient things, because nobody can keep track of them. I mean, I'm in the field, and it's hard to keep track of who's open. You know, how do you call? How do you get on the list? You know, who do you call? And what's open to you? Where are they? You know, it's not easy at all. We try, and Hilo Medical Center tries, you know, because they have some backup with social services and so forth. But you know, for somebody practicing outside in the field, it's a big challenge. I mean, you know, like I said, we try to be all things to everybody, but you know. Social service is not easy for you know, a primary care practice to do. You know, it's it almost seems like you know, there is room for that kind of service for people that you know, that are on the outpatient basis and need help. You know, a call to this number where they can maneuver you through these things. I don't know. I don't know. I'd be the first one to refer my patients there if there was such a service. Though, you know.
So we're talking about that kind of information service,
Information.
the need for beds, whether it's private sector, public sector, the community-based.
We actually have an easier time trying to determine hotel occupancy than we do trying to determine
That's a good point.
the availability of long-term care services.
Oh, that's very, very. And you, Lisa, you mentioned the workforce that provide the care and the services, and you know, you had mentioned, is it CNA?
Certified nurses assistant. The need, there's just not enough of qualified individuals that have been trained, and then they have to be recertified, and you know, we just need programs that are available, that are affordable to them, to be able to keep up with the demand.
And can that be done through like a community college, through like an associate degree program? Or?
It doesn't even need to be through a community college. There are facilities that can do, you know, they're approved by the state. They have their state approved programs, and their program is 8 to 12 weeks long, and then if they pass the test at the end of the practical and the clinical training, then they become certified.
I see. But that's what's relatively expensive in your mind, and so
right. So there's a holdback there, right? So.
Well, I know that one of our future discussions is going to be on the workforce development programs for our healthcare industry, because I think that's in all aspects, not just long-term care. You know, those are deficits that we need to figure out ways to fill. So, Bobby?
Well, Russell, time passes quickly, and you know, we want to really thank you all for taking the time to be with us to talk about our long-term care crises.
And I think we've really just kind of scratched the surface. So it's something that we need to revisit and be able to provide some comfort to our residents on the Big Island. Thank you for joining us today.
Thank you.
Thank you.
Aloha.
Thank you.
Great.